Hello everyone. Today, we're diving into the world of a medication called Enasidenib, commonly known by its brand name, Idhifa. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Enasidenib, often recognized by its brand name Idhifa, is an oral tablet that belongs to a class of medications known as IDH2 inhibitors. It is primarily used to treat acute myeloid leukemia, AML, that has a specific genetic mutation called isocitrate dehydrogenase 2, IDH2. Approved by the FDA in 2017, Idhifa is prescribed for patients who have relapsed or refractory AML, meaning the cancer has returned after treatment or has not responded to previous treatments. This medication works by blocking the IDH2 enzyme, which is involved in cell growth and metabolism, thereby slowing or stopping the growth of cancer cells. Warnings: Enasidenib comes with its set of precautions. It is not intended for use in patients without the IDH2 mutation, as its effectiveness is specifically tied to this genetic characteristic. One of the serious risks associated with Idhifa is differentiation syndrome, a condition that can be life-threatening if not treated promptly. Symptoms of differentiation syndrome include fever, difficulty breathing, rapid weight gain, swelling of the arms and legs, and low blood pressure. If you experience any of these symptoms, it is crucial to seek medical attention immediately. Additionally, patients may experience elevated levels of bilirubin in the blood, which can lead to jaundice, yellowing of the skin and eyes. Before taking this medicine. Before starting Enasidenib, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. If you have a history of liver problems, it is particularly important to discuss this with your doctor, as Idhifa can cause liver enzyme elevations. Women who are pregnant or planning to become pregnant should avoid this medication due to potential harm to the unborn baby. Similarly, breastfeeding is not recommended during treatment with Idhifa and for at least 1 month after the last dose. Patients should also inform their healthcare provider about all medications, supplements, and herbal products they are taking to avoid any adverse interactions. Side effects: all medications can have side effects, and Enasidenib is no exception. Common side effects include nausea, vomiting, diarrhea, decreased appetite, and jaundice. Some individuals may experience fatigue, muscle pain, joint pain, and changes in taste. Serious side effects include differentiation syndrome, elevated liver enzymes, high blood sugar, hyperglycemia, and low levels of certain blood cells, which can increase the risk of infections. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Regular blood tests will be necessary to monitor your liver function and blood cell counts during treatment with Idhifa. Interactions: Enasidenib may interact with other medications, so it's of utmost importance to inform your doctor about all the medications you are currently taking. This includes prescription drugs, over-the-counter medications, vitamins, and herbal supplements. Your healthcare provider can help manage potential interactions to ensure the safe use of Idhifa. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Enasidenib. The usual starting dose of Idhifa is 100 mg taken orally once daily. It can be taken with or without food. It is important to take the medication at the same time each day. Do not crush, chew, or split the tablets. If you miss a dose, take it as soon as you remember on the same day, but skip the missed dose if it is almost time for your next dose. Do not take 2 doses at the same time. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Avoid: while on Enasidenib, it is advisable to avoid activities that might increase the risk of bleeding or injury, as the medication can lower blood cell counts. Stay hydrated and follow your healthcare provider's dietary recommendations. Avoid consuming alcohol, as it can exacerbate certain side effects, particularly those related to liver function. FAQ: many wonder about the age restrictions for Enasidenib. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of Enasidenib. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.